The diagram showing the intramuscular spaces or the scapular spaces. We are trying to recreate this diagram. So for that we should know the four anatomical landmarks starting from the, so we are living on the posterior aspect of the scapula. The scapula is a triangular shaped bone with a lateral glenoid cavity. This is a glenoid cavity of the scapula. To demarcate the posterior aspect, we know there will be a spine of the scapula here, and further we can see the head of the humerus goes and articulate with the scapula to form the shoulder joint. So these are the two important landmarks, and further we can see there are certain muscles which encloses. These are the scapular muscles. So first we can see there is a, from the lateral bottom of scapula we can see two rounded muscles are located on the from it is starting, these are rounded muscles, so it is known by the name teres muscle. Teres minor above, so we can see a minor muscle called teres minor attached to the greater tuberosity of the greater tubercle of the humerus, and below we can see another muscle called, below we can see another rounded muscle called, this one is the teres major muscle attaching towards the medial lip of the bicipital groove, the lady between two benches. The medial major is the, this muscle, this rounded muscle, this is the teres major, and the space is enclosed by, you look at this point, this is the infraglenoid tubercle. So we can see this, there is a muscle originating from the infraglenoid tubercle, and this muscle is going towards the, this muscle is going towards the humerus. This muscle is the, on the posterior aspect, this one is a triceps muscle. So these are the four landmarks. First one is the shaft of the humerus, second one is the long head of triceps, then this one is the teres minor, and this one is the teres major. So these provide three spaces. We can see there are three spaces. We can see an upper quadrangular space here, and we can see a upper triangular space here, and also we can see a lower triangular space. And if you say the boundaries of the upper triangular space, if you say the boundaries of the upper triangular space, this one is bounded by the quadrangular space is bounded by laterally by the shaft of humerus, medially by the long head of triceps, superiorly by the teres minor, inferiorly by the teres major. Now what is the content of this upper quadrangular space? We can see the content of the upper quadrangular space is, we can see an artery, and there is another nerve winding around the surgical neck of the, there is a main content. It's not, this one is the axillary nerve, this one is the axillary nerve, and the posterior circumference humeral artery and vessels. These are branches of the third part of the axillary artery. So this is the contents of the upper quadrangular space. Now we can see this one is the upper triangular space bounded laterally by the long head of triceps, superiorly by the teres minor, and inferiorly by the teres major. There is only one content, we can see one artery here, that is the circumflex scapular artery that circumflex around the lateral bottom of the scapula. Further we can see there is another lower triangular, another triangular space, lower triangular space bounded laterally by the shaft of humerus, medially by the long head of triceps, and superiorly by the teres major. So this is a lower triangular space. The lower triangle consists of a major nerve, a thickened nerve called, this is a spiral groove, or the S-shaped spiral groove. We can see the radial nerve here, and the artery accompanying that, or the vessels accompanying that, will be the profunda brachivessels. So these are the contents of the different space. So you write that contents, we can see this one is circumflex scapular artery, this one is the axillary nerve, and the posterior circumflex humeral artery and artery and vein, and here we can see the radial nerve in the spiral groove, and this one is the profunda brachii. So these are the various spaces and the intramuscular space.